Now we're going to start working on the skeletal system and actually learning about the different bones in the skeletal system. So with bone classification, we have what's referred to as flat bones. These are going to be thin, flattened, usually a bit curved in some areas, and some examples of these will be things like the sternum, the scapula, the ribs, and most skull bones. Remember, these are going to be the ones where you saw the compact bone on each side, the top and the bottom, and you're going to have that spongy bone going through the center. Then you have your long bones. These are going to be longer than they are wide. They have a shaft plus two ends often expanded. So they're going to have two epiphyses, and then they're going to have that diaphysis through the center. These are going to serve as a rigid lever that's acted upon by the skeletal muscles to provide major body movement. So the muscles will be attached to these, and these will help you move the body around. All limb bones except the patella, the wrist, and the ankle will be classified in with the long bones. And so here you can see you have that long bone there, and you have a flat bone. Next, we'll talk about short bones. They're going to be equal in length and width. Most of the time, these are referred to as like a cubed-shaped type bone, and they're going to provide limited gliding movements. So we'll find these in places such as the wrist and the ankle. You'll have some referred to as sesamoid bones. These are going to be a special type to form in tendon. Next, you have what's referred to as your irregular bones. They don't really fit into any of the above categories, and these are going to be things like your vertebra and your hip bones. So looking over at our skeleton here, we see our long bones. You're going to find that in the humerus. You'll also find that in the forearm bones of the ulna and the radius. You'll find them in the femur, and you'll find them in the tibia and fibula there. Going over to the flat bones, that you see this one's the sternum, so it's found or referred to as the breastbone sometimes. And you'll also find it in places like the skull and facial bones. Short bones are going to be these here. You're going to find those in the ankles as well as in the wrist or carpal bones. And then your irregular bones, like this vertebra. And so you'll find that in the vertebral column with the different vertebrae. Some bones that you'll find within the skull are going to be referred to as sutural bones. These bones are going to be very small, and they're also going to have extra bone plates located within the sutures of the cranial bones. Now with these can be pretty much kind of a personal type bone. Your different sutural bones, you may have different numbers of those. They might be somewhat of a different shape. And so these aren't going to be given any specific type of name that we're going to give them here. Just know them as sutural bones. And then you're going to have your sutures. Sutures are going to be areas where flat bones come together and join. And so sutural bones, here's some here. You'll have some little sutural bones there. And then the sutures are going to be these specific lines that will join your major bones together. And so you'll see this is a suture. And then you'll have that is a suture. And then you'll have a suture back here. And so those are going to be where those bone plates are going to come together, and eventually from the infant into childhood, they will start to grow together and eventually solidify into those sutures. Fissures are going to be narrow slits between bones for passage of blood vessels and or nerves. And so here inside of the eye socket is referred to as an orbital or the orbit. And so inside you see that referred to as the superior orbital fissure. And so that's going to be where the blood vessels and the optic nerve and thing are going to come in and attach into the eye. A foramen is going to be a hole, which is going to be a passageway for blood vessels, nerves, or ligaments. In this case, this large foramen here at the base of the skull is going to be where the brainstem comes out and the vertebral column will go along. Fossas are going to be shallow depressions. So here, you're going to see the mandibular fossa, so that is a depression where the mandible or the jawbone will articulate in with the skull. Then you have a tube-like opening, and those tube-like openings are referred to as a meatus. I know it looks like meat in us, but it's referred to as a meatus. So here you have what's referred to as your external auditory meatus, and that's going to be the opening for the ear canal. Condyles are going to be rounded projections with a smooth articular surface. Remember, articular surfaces are going to be surfaces that come in contact with other bones. They articulate with other bones. And so here you have a condylar process that would articulate with the skull back here with that mandibular fossa. And so that's your rounded projection there. Epicondyles are usually going to be roughened projections on a condyle. And so here you see an epicondyle, which is going to be located up here and up here. So it's a rough projection above the condyle. The condyle is going to be the smoother section here. And so this is your femur, and I know this is the back of the leg or femur, simply because you have this indentation here, and I can see those, the medial condyle and medial epicondyle, as well as the lateral condyle and lateral epicondyle. So that tells me it's the back of the leg. If it was the front of the leg, it would have a smooth patellar surface. Another bone marking that you would find would be a line. Lines are going to be long, narrow ridges or borders that are going to be less prominent than a crest. And so we have a line here, and you're going to find a line here. And so they're not going to stick up as much as what we would refer to as a crest. A facet is going to be a smooth, flat, slightly concave articular surface. And so it's kind of like what you saw on the condyles where you were looking at where they came into contact, but you're going to see this one on the vertebrae. Another marking is going to be referred to as a head. It's usually a rounded articular process that's going to be supported on a neck. Now this is going to be a rib, and you see the head towards the surface, and then the neck is going to be the supporting process. And then we come to our crest. Crests are going to be prominent ridges or elongated processes. And so here you see the median crest on the sacrum. And so that goes down the center of that sacrum. Spinous processes are going to be sharp, slender projections. And so that's what's actually making up the spine when you're looking at the spine. A trochanter is going to be a very large projection found only on the femur. And so you're going to have what's referred to as a greater trochanter and a lesser trochanter. And so with the trochanters, here is your lesser trochanter there. And then up top, you're going to have the greater trochanter. Next, you have your tubercle. These are variable in size, and they're going to be simply rounded projections. So here you have this rounded projection here, which is going to be referred to as an articular tubercle. You also have what's referred to as tuberosities. These are also variable in size, so they can be different sizes, and they're projections with rough, bumpy surfaces. And so with this one, here we're going to have sacral tuberosities on both sides. Skeletal system organization. So we talked about it briefly in the last unit about the axial and appendicular skeleton, and let's go into that a little bit more. So this section that we're going to be looking at specifically with this video is going to be the axial skeleton. And so with the axial skeleton, the bones are going to protect the organs of the head, neck, and trunk. They're going to consist of the skull, the hyoid bone, the vertebral column, the thoracic cage, and then we head on over to the appendicular skeleton, and those are going to be bones of the upper and lower limbs and the bones that anchor them to the axial skeleton. So if you want to think of axial as along the axis and appendicular as the appendages. So here they're going to have the pectoral girdle, the upper limbs, the pelvic girdle, and the lower limbs. So the axial skeleton here on the left-hand side is everything that's shown in this blue color. And then the appendicular skeleton is going to be everything shown in the blue on the right-hand side. Starting off, we know the skeletal system consists of 206 bones. With the axial skeleton, which we're working with today, it's going to consist of 80 of those bones. You can divide them into different units and subunits. So first, dividing the axial skeleton into 3 subunits, we're going to have the skull and associated bones. You'll have the thoracic cage, and then you'll have the vertebral column. So first, let's go into the skull and associated bones. So divide that into further subunits. You can make it into the skull and associated bones. And with the skull, you're going to have cranium. It consists of 8 bones you're going to learn. And the face, and it's going to contain 14 facial bones. Associated bones are going to be the auditory ossicles. So you will have 3 ossicles or hearing bones or ear bones inside on each side. And then you'll have your hyoid, which is going to be right below the mandible, kind of in connection almost with the vertebral column, and that's what your tongue's actually going to be attached to. Then you'll go into the thoracic cage. So that will be, for example, when we go over these bones here, that will be like your first bone test, the skull test. Then we'll go into our next test, or our next section, which will consist of the thoracic and the vertebral column. So with the thoracic cage, it'll consist of the sternum and ribs, and then you'll come down with the vertebral column, and it'll be the vertebrae, the sacrum, and the coccyx. So let's start us out with the cranium. The bones that are listed, it tells you the name of them, and it will tell you how many of each of those that you have. So starting us out, we have that occipital bone here. And so with the occipital bone, you're going to find that around the back of the skull, and you're going to have one of those. Next, we have the parietal bone. You're going to have 2 of those, and so you have one on each side of the head here. Then you'll have the frontal bone. There's going to be one of those that goes across the forehead and makes up the ridges of the eye and part of that orbital. Then you have your temporal bones. The temporal bone is going to consist of all of this section here in a reddy pink color. There is going to be 2 temporal bones, one on each side. Then you have your sphenoid. That sphenoid is going to be this purple bone here. It goes through the inside of the skull and helps make up some of that cranium section. And it comes out on the other side, so you only have one of those. And then the next, you're going to have your ethmoid. There's only going to be one of those, and it helps make up part of that nose septum and nasal septum, part of the eye orbital socket, and it goes within the skull as well. So those are your 8 cranial bones. Coming over to the facial bones, you're going to have 14 total of those. You're going to have 2 maxilla or maxillae. The maxilla is going to be a plate that makes up the upper lip and going into part of that eye socket here. You have 2 palatine bones. The palatine bone you cannot see, but is going to make up part of the roof of the mouth and goes into the interior part of the body or the skull. Then you have 2 nasal bones. That nasal bone is going to be found right there, and it comes together in the center on each side with kind of a little suture. You have the inferior nasal concha, and you will have 2 of those. That will be found inside of the nose section. You have 2 zygomatic bones. Those are going to be your cheek bones in blue here. You're going to have 2 lacrimal bones. Those are going to be found within the eye socket. You'll also find the lacrimal or tear ducts there. You'll have 1 vomer. The vomer is going to come up from the inside part here, but actually makes up part of the septum inside of the nose here. So it's going to be a long one that you can't see kind of behind that cheekbone there. And then you have the mandible, and there's one of those, and that's basically all of this here in gray. That's going to make up your lower jaw. That is the only facial bone that is not attached but can be freely moving. Next, with the associated bones, you have what's referred to as the hyoid bone. That hyoid bone is going to be the bone that is actually not articulating to any other bone in the body. It's going to be attached through ligaments and things like that, and you're going to have your tongue attached to that. Next, you have your auditory ossicles, and those are going to be within that ear canal, and there's going to be 3 on each side. Looking below, you can see those 3 different bones for the auditory ossicles, and they're very, very small. That's compared to a dime. So let's go into memorizing these bones. The first starting out is going to be that parietal bone. Remember you have, let's let it catch up. All right, that's going to be found on each side here and here. So you had your 2 parietal bones. In the center here, you're going to have a suture that separates both of them, and that's referred to as the sagittal suture. So let's say you're going to take your hair and you're going to part it straight through the center of your top of your head. That would be the sagittal suture that separates those 2. The frontal bone is this big forehead bone here, and it is separated from those parietal bones through what's referred to as a coronal suture. And so that suture runs along the head, kind of like a headband, if you were to wear a headband of some sort. Get rid of these lines and get some new ones. So that's the coronal suture. Next, looking at that lacrimal bone. That lacrimal bone is going to be the first bone in the eye. So we're coming on in here, and it's going to be in green. That's where the lacrimal ducts can be found. Then you have your ethmoid bone, which helps make up part of the eye socket in there, and the orbital. Then you have your squamous suture, and just depending on what book you use, this one calls it a squamosal suture. We call it a squamous suture here. That basically kind of goes around the ear. It's going to separate the parietal bone from the temporal bone on the side. So call it your squamous suture for this one here. Then you have your sphenoid. That sphenoid is going to be this purpley pink bone here, but it also makes up the back part of the orbital or eye socket on each side. Then you have the temporal bone, which is going to be this one through here. It's going to consist of the external acoustic meatus. You're going to have your ossicles in there. And it will also have like your mastoid and styloid processes, which we'll see in a minute when we turn to the side. Next, you have what's referred to as the perpendicular plate of the ethmoid bone. So remember that ethmoid bone up top here and over here? Well, it's one bone, and it goes through the inside of the skull, and it also makes up this section here. So it's part of this perpendicular plate there, and then it's also going to be the middle nasal concha. So those 2 pieces there, same bone, but you have to know the different parts. So just ethmoid in the eye, when it's coming down from the top, which is this one here, is the perpendicular plate of the ethmoid. If it's the 2 side pieces, here and here, it's going to be the middle nasal concha. You do have superior, but it's further up and you can't see. Now coming on down, I'm going to go ahead and get this bone in here with it. That is the vomer. So the vomer and the perpendicular plate of the ethmoid bone come together to create the nasal septum. You have to know that. That's what separates your 2 nasal canals. So that vomer and the perpendicular plate of the ethmoid bone, they come together and fuse and make the septum. Coming on down, we have our infraorbital foramen. Infra below, it's a foramen, it's a hole. So you see that on each side there. It's actually found in the maxilla bone, which is the upper lip bone. We talked about the vomer, and then the mandible, which is going to be your jawbone. Now with the mandible, you have specific parts. You're going to have the mental foramen, which are the openings or holes on the mandible. You have this part that kind of sticks up here that's called the mental protuberance. You have the long section of the jaw here on each side, which is referred to as the mandibular ramus. And we'll look at that more when we look at the side view. Okay, coming to the top, over on the right-hand side, we have holes above the orbitals, and those are going to be called the supraorbital foramen. Then, coming on down, you have this nasal bone here. Notice there's two of those. They come together and they form that bridge of the nose. You have the sphenoid again on the inner eye socket or inside the orbital. You have the middle nasal concha, again, pointing at the sides. You have the bright green, which is your cheekbone. That is the zygomatic bone. Then you have the lower concha, which is going to be the inferior nasal concha. They're in blue. You have the upper lip bone, which is all of this in yellow, even helps make up part of the orbital or eye socket, and that is referred to as the maxilla. Next, you'll have what we call the teeth, which are going to be structures that stick out. You're going to call them the alveolar processes. Alveolar processes. All right, so looking at it from the side, you can see some of these a little bit better. So you have, let's start on the left-hand side, you have the parietal bone in the grayish blue. You have the squamous suture. And so we're going to come through here. This is what's going to make up your squamous suture. You have the lambdoidal suture. And in our book, and these, of course, it just depends on what text you're using. We call it the lambdoid suture. So call it lambdoid. Then you have the occipital bone, which is the back of the head bone. That's in this bluish purple or indigo color. You have the temporal bone, which is in the bright red through here. You have the external auditory meatus. That's the ear canal. And you're going to have some processes. The more rounded process at the base of the skull is called the mastoid process. The pointy section in here is going to be referred to as the styloid process. Next, you have the zygomatic part right here, but notice it's red like the temporal bone. And so that's going to be referred to as the zygomatic process of the temporal bone. This is referred to as the temporal process of the zygomatic bone. You put them together and they create the zygomatic arch. So this section here that sticks out together is a zygomatic arch. So when you actually look at a skeleton, you can notice that you can put your fingers around inside of that section because it sits away from the skull. So that's what's actually making up those high cheekbones that you're looking at that come up to the side. Coming down, we have the mandibular condyle. That's that rounded section here. Then you're going to come over and you have what's referred to as the coronoid process. And so that's going to be the projection that sticks out towards the front of the mouth or towards that maxilla. So the back part is going to be the mandibular condyle. The front part is going to be the coronoid process. So C-O-R-O-N-O-I-D, process. Coming over to the right-hand side, you have the coronal suture. Remember that one's the one that comes across like a headband. You have the frontal bone, which is the forehead. The sphenoid, which makes up the side and then part of the orbital of the eye socket. The ethmoid bone, which is going to be inside here and helps make up the perpendicular plate. The lacrimal bone, which makes up right there where the lacrimal gland is going to be, the tear duct. The nasal bone on top. The zygomatic bone, which is the cheekbone in green. And the maxilla, which is going to be the upper lip, which is in yellow. and the mandible, which is going to be the jaw here. Now, this whole section here is that mandibular ramus, so that long section of the jawbone. That's referred to as the mandibular ramus. Right. And then your teeth, remember, are going to be called the alveolar processes. Looking at it from the bottom of the skull, here's where you're going to actually see the palatine process of the maxilla, and so it's going to be in plates, and then you actually see that palatine bone, and we're on the right hand side here. Oops, sorry. So that palatine bone is in blue, and so remember that was, goodness, drawing, go back, give it a second to kick in. All right. So you see that palatine bone in there. You could not see it as part of the facial bones when you're looking at the face directly, but it's going to be that blue bone inside of there. It's considered one of the facial bones. Okay, from the side you can see, remember how I told you there was going to be this big opening for the zygomatic arch, and that's going to be created by that zygomatic and temporal section there. And just looking at these, you see the vomer from the inside. You're going to see the mandibular fossa, which is that indention there. You have the styloid process, looking at it from underneath. The external acoustic meatus or auditory meatus, same thing, depending on what book or text you're using. That mastoid process, which is the more rounded projection. The occipital condyle, and so that's going to be a condyle that's found on the occipital bone. And then, of course, the temporal bone is the red there, all that bright red. Coming on over, you have where your spinal cord comes out, and that's a hole. So it's a foramen magnum because it's a large hole. You see this lambdoid suture coming around through here. And then you have that occipital bone. Looking at the inside of the bone. First off, starting off with that ethmoid, it can be broken down into different parts. And so within the ethmoid bone, you're going to have what's referred to as the crista galli, which is going to be that small section through the center. The side sections, which look dotted, are going to be referred to as the cribriform plate. Together, they help make up that ethmoid. And this would be looking if you took the skull cap off and you're looking down on the inside of the cranium. You see the frontal bone made up of the orangey yellow. You have the sphenoid, and notice how it kind of looks like a bat and has a bat shape. You see each temporal bone. You see the parietal bone. You see the foramen magnum, which is the big hole, and then the occipital bone for the back of the head or skull. This is taking it and slicing through, like between the eyes, through the skull, and opening it up. So this would be referred to as a sagittal or mid-sagittal cut. And so now we're looking at the inside of not only the cranium, but also the facial bones. And so you see the coronal suture going across the top, the frontal bone, and then you'll see also a frontal sinus. Now, 4 bones are going to contain sinus cavities. And so the frontal bone is going to be one of those. Those sinus cavities help with resonance of sound. They help listening and hearing things and making sound. But they also help lighten the skull. So the skull's not very heavy to carry around. So there you see your frontal sinus. You'll also, from this view, have a sphenoid sinus that's found in the sphenoid. Then you'll have a maxillary sinus. I'm not seeing it on this section. And you'll also have a ethmoid sinus cavity, which I'm not seeing on this section. So those are your 4 sinus cavities. Your frontal. Then you're going to have your sphenoid, your maxillary, which is found in the maxilla, and your ethmoid sinuses. So those are the 4 that you need to know. They help with sound and resonance, and they also help lighten the skull. Right, coming on down. So now we have the nasal bone that you see. You see this perpendicular plate of the ethmoid. You also see this vomer. Remember, these two come together to make the septum. You have the inferior nasal concha showing here. You see the palatine process of the maxilla. So this is all maxilla, but called the palatine process. And then you actually see that palatine bone through there. And then the maxilla is the upper lip, and the mandible is the lower lip. Coming on over, you see the temporal bone in bright red, the parietal bone in blue, the lambdoid suture coming across the back, the occipital bone, the sella turcica, which is going to be found in this section here, and then the foramen magnum, which is going to be a big hole at the base. Of course, your pointy styloid process. We talked about the sphenoid sinuses. And we talked about the palatine bone, the vomer, and then your teeth. The sections here are alveolar processes. All right, so in those paranasal sinuses, you're going to have like mucous membranes that are going to line the cavities in the frontal, maxillary, sphenoid, and ethmoid bones. They're going to be used, like we said, in resonating or echoing chambers to enhance the voice, as well as structures that increase the surface area of the nasal mucosa, and they're going to help moisten when you breathe in. So when that air comes in, it's going to be very dry, and it has to be heated and moistened. And so these are also going to be things that are done here. And so looking at these paranasal sinuses, this gives you a better view of what they look like. Okay. Going in, this shows you a closer look at the sinus cavities and the makeup of the portion of the inside of the facial bones. And here also. So let's say that you have a sinus headache. Depending on where that pressure is and depending on where the mucus has built up and possibly gotten a bacterial infection inside, if it's on the upper portion of the forehead and skull, it would be frontal. Ethmoid, you can see there. Sphenoids further down, but also could be on the sides of the head. And then the maxillary sinuses are going to be on the upper part. Sometimes it makes your teeth hurt with those. Now with a baby, when they're born, their skull is still going to be part cartilage. They're going to have openings between the skull bones or skull plates. And so there you're going to have the sutures and things starting to form, but they're still going to be cartilage. And so looking at these, we're going to refer to as fontanelles. So you have the sphenoid fontanelle. You're going to have the mastoid fontanelle. And those are large sections of cartilage. And eventually these bones will grow together, they'll calcify and create sutures. Looking at the top, you can see that big opening with the anterior fontanelle. That's where you're going to find the soft spot when the baby's first born. And there's a smaller section called the posterior fontanelle. So looking here at an actual part of a bottom plate of the skeleton, looking at the occipital bone, and you'll see different sections to that occipital bone. So you have, for example, the inferior nuchal line, and of course the nuchal is going to be the neck section. You have the superior nuchal line. You have external occipital protuberance. And protuberance is somewhere it just kind of sticks out, kind of like you had your mental protuberance up front on your chin. You have an occipital condyle. You have the foramen magnum and the occipital crest, which is going to be a line that sticks up high. Looking on the side of the skull, you have the temporal bone here. Some of the things you might notice on there are going to be that superior temporal line and an inferior temporal line. So you have to actually have that skull there and look at it close and you can see it. Also notice over to the side that it's going to have these sutural bones here, and those are going to be unique to the person. Looking at the frontal bone, you have what's referred to as a frontal or metotopic suture through the center there of the forehead. You have a section that kind of between the eyes that's going to be referred to as the glabella. You need to know that. You have the supraorbital margin, which is going to be where that eyebrow kind of is. You have what's referred to as a supraorbital notch, and that's going to be like an indentation there in that eye socket or orbital region. Looking here at the inferior orbital surface, so they basically took the skull and you're looking at the top portions of the frontal bone. And so you can see the sinus there. You see that supraorbital foramen, which is going to be a hole. You see the lacrimal fossa and the supraorbital margin, which is going to be the outline or lining of that orbital or eye socket. Kind of, if you put your hands there, it's kind of close to those eyebrows. Looking inside there, this is going to be the temporal bone from the inside. And so you have a squamous part, an internal acoustic meatus. You see how it's coming in. You see the zygomatic process. And you also see the mastoid, which is the rounded process, and the styloid, which is the more pointy process. Looking at the lateral or the outer view or side view of the temporal bone, you see that external acoustic meatus again. You see that mandibular fossa and the zygomatic process. Okay, looking closer into that external acoustic meatus, and you see how that mastoid process is kind of right behind it. So that's going to be opening for the ear canal. And then the mastoid process, you see that spongy bone kind of making up behind that ear canal. This here is going to be, makes up the sphenoid bone. Remember we said it was kind of bat-shaped? And so this is what it looks like. It's one bone that goes through the entire inside of the skull and helps make the base of the cranium and makes up the inside part of the facial. Looking at it from the front, you see the different parts also. You can definitely see the sphenoidal sinus cavity. And next, we're coming into the ethmoid bone. That's going to be in the center also. And looking at it from the side there. Now we're looking at the maxilla, which is going to be the upper portion of the mouth. You see it has an infraorbital foramen there. You see the anterior nasal spine, the alveolar processes, and going into the zygomatic process. And then the palatine bone, which is going to be in the inner portion. And then just a front view, you see the supraorbital foramen. You see that nasal bone where it's come together in the center. You have two on each side, one on each side, which makes two. You see the sphenoid making up part of the eye socket or orbital, the temporal bone on the side, the zygomaticofacial foramen. So you are going to have a hole on each side on the zygomatic bone. The zygomatic bone itself, the infraorbital foramen, that's going to be found in the maxilla underneath the eye. And looking in through the center, you see that perpendicular plate of the ethmoid bone and the vomer, and they're coming together to make the bony nasal septum. So the septum is technically made of two bones. Now we're looking over to the side. We have our lacrimal sulcus, which is going to be in the lacrimal. You're going to have the optic canal, where the optic nerve will help come in, the supraorbital fissures, that lacrimal bone. You see the middle nasal concha, the inferior nasal concha, temporal process of the zygomatic bone, and then that mastoid process, which is part of the temporal bone as well. So this is just another look at the inside of the eye, and it's got each bone a different color so you can see the difference. Here's another visual using an actual skull. Going down, looking at the only bone that is free movable on the facial bones, which is the mandible. You've got teeth, you've got those alveolar parts or processes, you've got the articular surface of the temporomandibular joint, you've got the coronoid process, you've got a mandibular notch, you've got the head of the mandible, the condylar process, the ramus, like I said, which is the long section, the angle, which is the rounded section of the ramus there. So that section there. You see the mental foramen, and of course, like we said again, that mental protuberance. So know all those. And here's another view. You do not have to know the mylohyoid line or the depression for submandibular salivary glands. Now looking at the hyoid bone, this is the only bone that's not attached to any other bone in our body. And so with it, it is going to be attached to the tongue, and it's found right above the voice box in the trachea. And it's going to have specific parts to it. The main section in the center is referred to as the body. The two sections that are coming off are called lesser horns. And then the ends are referred to as the greater horn on each side. All right, so that's your skull. I'm going to go ahead and stop here, learn all of the facial and cranial bones along with the different processes, foramens, and the different bone markings that I mentioned.